Hi, I'm Morse, the founder of Core Elements Training. In this short video, we're going to demonstrate clinical dry cupping to the pectoral and the anterior deltoid region. So dry cupping therapy is an excellent modality for helping to reduce muscular-related pain and discomfort, along with increasing range of motion around the associated joint. It's also really useful for helping to increase localized circulation. And when we're increasing that localized circulation, that's helping to bring more blood flow and oxygen to the affected area. So focusing on the pectorals and the deltoid region is really useful for clients that might be suffering with a shoulder-related injury, whether that's adhesive capsulitis or whether that's a strain or a wider injury around the area where the client might have restricted range of motion. So first of all, before putting the cups onto the area, we need to apply our massage medium. So in this instance, I'm going to use lotion. So I'm using the Physique lotion today, but you could use any type of medium that you already use in your clinic, whether that's oil or whether that's wax. So we're going to apply the lotion to the affected area. Okay, now normally you're going to put on more lotion than you would do for your manual massage techniques. Okay, so we're coming into making sure that we're focusing on the pectoral region. So with our female clients, we're making sure that our towel technique is effective. And in some instances, you might need to ask your client to just hold the towel when it's nice and secure in order to lower some of that wider tissue around the area. So I've applied the lotion. I've already palpated. We might have done our pre-treatment testing to identify where the restrictions are. And then once you've got that lotion on, we're then going to apply the cups. So I'm using the Dongbang cups at the moment. So they've got a slight valve on the top here. Okay, so I'm going to start off near the anterior deltoid. So I'm placing my first cup onto the anterior deltoid area. Okay, and just pick your cup sizes in relation to the size of your client. Okay, then I'm following that clavicle line. So I palpate for the clavicle bone and I can feel where that clavicle bone is. And I'm sort of bringing the cup just below the clavicle. I'm then coming in. And the nice thing with cupping the pec region is that you can come directly over the sternum as well. So just letting your client know what you're doing, because when you're coming over the sternum, pump is becoming a little bit invasive there. You're all right there, Katie? And then following over to the other side. Now the chest area, especially if your client is active, the chest area can mark quite a lot. So as with cupping to all of the wider areas of the body, we're checking the suction on the client, making sure that they feel comfortable. So we haven't put too much suction into the cups. We're checking the coloration of the cups as well. So one of the key points with these cups is that they're see-through. Being see-through allows us to monitor the colour of the cupping mark, and it also allows us to monitor if there's any blistering or any adverse effects happening to the client whilst they've got the cups on. Quite often, if there's quite a lot of heat in the muscular area, then the cups can steam up. And that's exactly the same as what happens when we're doing our manual massage techniques. So sometimes when we're relieving tension from the manual massage techniques, then the pores can open and there can be a sweat response. And the same thing can happen with the cups. And in this instance, we can see there's a little bit of a sweat response because there's a little bit of steaming inside the cup there. So we might want to leave these on statically for our clients. So these, with that lift of the tissue, this is going to help to reduce muscle tension and trigger a stretch reflex, which then leads to relaxation within the muscle tissue. So if the client is feeling quite sensitive around the area, we might just stay with our static cupping for that first session. Alternatively, if they are comfortable, then we can take them into a couple of stretching techniques. So in this instance, I can take hold of Katie's arm, okay, supporting at the forearm and supporting underneath the upper arm as well. And then I can take that arm into abduction, coming back to the center, and then I'm abducting the arm. So the client then will feel an increase in stretch around the area. So this abduction and adduction movement might be enough for the client today. Alternatively, if they're comfortable with that and after a couple of repetitions, what we can then do is again hold the forearm, hold underneath the humerus, and then take them into rotation. Sometimes the cups might make some noises as they slightly change in their positioning. Okay, can you feel that?
Yeah.
Okay, so make sure you're monitoring that sensation. So it shouldn't be painful. If it's painful, then you're going to need to reduce that suction inside the cup. Then when we're doing those stretching techniques, generally 3 to 5 repetitions is enough to trigger a further stretch reflex within the tissue. Okay, so we could leave them on statically, then do that stretching technique on both arms here, and then continue to leave those cups on statically to further reduce some of that tension. Or after we have stretched the tissue, we could put further suction into each of those cups because some of that tension will have relaxed. Okay. The other technique that we can do around the pectoral region is the sliding technique. Now, some of your clients will be really sensitive around the anterior deltoid and that pectoral area. So it might be enough to leave them static. But if you have got clients that have got more muscle mass, then they might be comfortable for you to do the sliding technique in the area. So I've just taken those cups off and I'm just checking to make sure that there's still enough medium on the client. I'm just bringing a little bit more medium on down that arm. Okay, then what I'm going to do is bring this cup back. I'm not putting as much. First time I put the cups on, I put 2 pumps into the cup. This time I've put 1.5 pumps into the cup. Now what I'm going to do is test the sliding ability because sliding can be a little bit uncomfortable sometimes. So I'm going to take my thumb and my finger and I'm testing to see whether I can slide that cup relatively easily, which I can. But I don't want it to be too easy that it slides without feeling any tension underneath. So I shouldn't have to tug the cup to get it to move. It should move relatively easily, but I can still feel this traction within the cup, which this one has got. So I've got 1.5 pumps in there at the moment. Now what I'm going to do is slide that cup forwards and backwards over that pectoral region. Okay, I could slide directly from one side over to the other side, which can feel quite nice. The nice thing with this sliding technique is that because we're lifting the tissue, we don't have to reduce much tension as we go over that sternum region. Again, we're following that clavicle line. And now from here, I'm now going to move into the deltoid region. So I'm now on the anterior deltoid. I lost a little bit of suction, so I've just put a little bit more suction into that cup. And now I'm into the anterior deltoid area and I can slide down this arm. Okay, so I'm sliding around anterior delt, coming over pectoral, either focusing on half of the area or focusing on the whole of that chest region. Then down, again back to anterior deltoid, and then that was the cup, and then back down the arm. So sometimes when you come in, if you can see on the camera, that junction where you've got the top of the arm, so if you're coming too near to that junction, sometimes you might lose a little bit of that traction, and then your cups are going to make some noises. Okay, so that's our static cupping technique. That's our stretching cupping technique where we're abducting the arm out to the side and coming back again, making sure that if you're doing that stretch technique of abduction and adduction of the humerus, that the arm is back to the center of the body when the cups are placed on. And then we've got our external and internal rotation as well at the shoulder joints, and then sliding across the pectoral region and then down the arm. Okay, thank you.